So you've decided you want to try therapy and have explored some options, but now comes the decision. How do you choose the right mental health professional for you? So let's talk about that. We recap a little bit. We've been talking about it. What if someone wants to take therapy? What is that first step for them? You mentioned reflection.
Yes. So the reflection, so you know exactly why you are seeking help and why you're
Mhm.
wanting some help, right? And then you could go to your family doctor. Like I say, I always recommend that as a first
Which is
line,
great.
which is really great just to make sure.
Yeah.
And then also for potential referrals. But some of my clients will start with saying, you know what, I'm going to go to a therapist that my friend recommends, or, I've got this name on a list of benefits and give it a try. Right. And then trust that person in the beginning. I know trust has to be built, that we'll refer accordingly. If we think, you know what, have you gone to the doctor yet?
Yeah.
I think a psychiatrist might be helpful as well. And what do you think? And we'll tag team together.
So the next step then, say, okay, I'm going now. And what are some good questions for that initial visit to try to figure out, is this going to be a right fit? Like, have you worked with clients with my kind of situation before? Or what are some of the questions they maybe should be asking?
Oh, for sure. And that's first of all, if we talk, we're doing a little bit of homework to make sure that the therapist or counselor that you're seeing has some specialization in what you're interested in. I think it is key to ask some very direct questions, just like like you expressed, like, do you have experience in this? And what is your most common approach in therapy? Right. And what modalities do you recommend? How frequently should I be coming in?
Great question.
Right. All those types of things. So you get as much clarity because you are a team. You're working together.
And I think that's
right?
important for people to understand too,
Yes.
instead of feeling like, well, I'm just going to receive, but no, you are
work
working together.
Mhm.
So now what if someone's had a bad experience with
Yes,
therapy?
yes.
I mean, how do you help someone with
Yeah,
through
that's
that
so
bad
hard.
experience, or maybe be willing to give it another chance or to find someone else?
And it's hard advice to give, but it's just don't give up. Because I understand, like in every field, right?
Yeah.
Sometimes we have negative experiences,
Sure.
whether it be a teacher or a doctor or a nurse, and you're not always going to connect.
Right.
Because sometimes, the bad experience is not even necessarily the therapist or yourself. Because rapport is still the number one predictor of once you have your baseline of training with your therapist, and your therapist has that training, how you connect with that person. So don't give up. If you didn't connect with that therapist, or if it turns out that therapist didn't give you the style, or you felt like you were being pushed into opening up, because there's a lot of vulnerability. If you don't feel comfortable, you do not continue with that therapist. You give it a couple of tries if you're just naturally uncomfortable, because it is very bearing of your soul at first when you
Well, I
first
think
go
that's the
in.
next one we're talking about. Getting to the point where you're like, okay, I have to be willing to open up. And that's a big step.
It is a big step. And making sure that you just feel really safe and comfortable, and that you feel like you can naturally open up with your therapist. And you do feel like the therapist is also like giving you tools and strategies, and that you are noticing, I think I'm making progress. And ideally, the therapist, I believe in my work, we ask the right questions to the client to get their own aha and their own clarity, and that
is
connect
the best
dots.
way, right? When
It
you
is.
see the light bulb go off in a person's mind, then you know that they actually see it.
This is
They
it.
got it. And
You
it's so
feel
much
it, right?
easier to start making the progress, right?
Yeah. And making the changes and being open to suggestions, because it feels meaningful, right? They get it, and insight.
So let's talk prevention. How can we be more proactive about our own mental health in the first place?
Well, like the metaphor of mental health being that of a garden, let's tend our garden on a daily basis. Knowing ourselves, the emotional intelligence is how well we know ourselves. And we check in with every other part of our body, our teeth, our hair. Let's check in on a daily basis on how we're doing emotionally, psychologically.
The thought that was just coming to me is that, we talk about don't take our loved ones for granted, but we shouldn't take ourselves for granted either. Because as you're saying, if we're not tending our own garden, then we might not realize that we are holding on to some emotions or things that are building up something that we don't want. We're getting a weed in there we don't want, and we're not even noticing it.
And that's often the way. And our loved ones would be like, are you okay? You don't seem like yourself. And it's like, wow, I think you're right. I have been feeling off, and let's try to figure out what's going on and make it better.
All right, 30 seconds. One common myth that you'd like to clear up about this topic.
Oh my gosh. Well, first of all, I think that psychotherapy is one of those things that it's not as hard, psychotherapy counseling, as hard as it sounds. Like people will often be like, ooh, and they avoid it because they think, you know what, it's going to be really, really hard and I have to dig deep. I'm going to be crying a lot. And yeah, we do dig deep sometimes, only as deep as you want to.
All
That's
right.
the key, only as deep as you want to.
There you go. Stay with us.